new grads, plastic surgeons, you go through 4 years of med school, ideally 6 years of training. So that's 10 years. That's like if you fast track everything, right?
Yeah.
And then you get out and you're offered $120,000 a year. That does not make sense.
Yeah.
I don't know how like some of my friends are taking these deals. I'm just like, what do you like? Oh, it's incentivized, but like the first 2-3 years, you can't even hit those like realistically, like unless you do something crazy, like you can't even get a bonus.
Like location wise, they're driven by their wives or like
Limiting themselves.
Yeah.
That is one of the main thing I've seen people like limiting their like income source is they're limiting the opportunities they're looking at. And also dependency. I was lucky. I had you like you had everything set up or just came in and worked.
Yeah.
But it's hard to set up your own practice. And it's also hard to trust somebody to like build that up. I've seen people join others and do really well. I've seen others join people and
I've seen more just getting taken advantage of.
Yeah, and then they leave within 6 to 18 months.
Yeah.
It's just crazy when I just hear that like the going rate for a new rate plastic surgeon is like 120, 130K.
Yeah.
That's like your average NP or PA.
Yeah. It's like doing a super fellowship.
Just become a hospitalist, make like, or go IM.
Yeah.
There's good gigs. You can make like 300K a year and work half of the year.
Yeah.
Right. Like that's out there.
Yeah.
So it's kind of like people are selling themselves short, like big time. And then they're like just trying to outcompete each other. It shows within 12 months, just like there's your burnout. There's like, you're not getting paid what you're worth.
Yeah.
Like,
yeah. It's tough for physicians to build that confidence, especially like when you're like kind of beaten down for 10 years, going through, med school and then training.
But I think plastics is probably worse. I mean, I think it's partly based because we have such a big cash component. I don't think people think through the process of getting to profitability. Again, like small business management, like you got to consider yourself and your skill level as like, you have your LLC.
Yeah.
Like you have to think of that as the entity. And like, you can't have your entity taking $120K a year with potential.
But let's say you make $10,000, like for $120K, like cosmetic surgeries, like you're talking about anywhere between 10 to 20 surgeries will cover that salary, right?
Yeah.
So that's like, and that's like within a month, you could pretty much like cover that.
Yeah. I mean, like let's say 25 surgeries will definitely more than cover that, right?
Yeah.
Even if you're like discount plastic surgeon.
Yeah.
So that's like one surgery every 2 weeks. Just doesn't make sense.
Double that for cost of, all you need to start is you need a front desk person and someone to schedule stuff. You don't need too many people to start your own practice.
I mean, if you're doing one case every 2 weeks,
you
could
just do one person.
Yeah.
Yeah.
Just put a fake mustache on top of your real mustache.
Yeah.
Come on, click this button.
Yeah.
It's not a high cost business. Obviously it grows to it.
Yeah.
Like what we have going is like, it costs a pretty penny to run it monthly, but you could grind it out and build it up as you go. Yeah,
you could run it very lean and like definitely don't need all the fancy machines, don't need anything like crazy. You could definitely start up with very minimal, like 50 to maybe 100 grand to start up, which you could probably easily get as a loan just coming out.
The physician's loan too. They probably have the best rates.
Start out on your own and just build from there. And I'm pretty sure like the first 6 months are going to be slow, but you take a few calls here and there, especially with what they're paying stipend for a plastic surgeon. You could definitely run your office and pay your bills with just covering call for a week,
And a lot of things I've heard from younger colleagues, they don't want to take call because even the stipend, they only get 30% of the stipend, which is just ridiculous.
Yeah.
Like I'm going to wreck my life, get woken up all hours of the night and just get 30% of this.
And these days, all you need to do is go to the hospital and ask for call, and you can pretty much be on the call schedule.